Hello, I'm Dr. Paul M. Spezia of Advanced Bone and Joint. I've been in orthopedic practice for over 27 years, and I have a special interest in the treatment of thumb and thumb disorders. When thumb pain is not responsive to conservative treatment, to include anti-inflammatory medications, steroid shots, activity modification, and bracing, we go on to surgical options. There's multiple surgeries that have been described, of which I've experienced and have performed these. The newer procedure that's out that I have used for the last several years has given reproducible results in not only pain relief, function, but also strength with minimal morbidity to the patient. It is called the Distraction Arthroplasty, utilizing the mini tightrope. So a little bit about the anatomy. This is the thumb. This is the metacarpal, this is the trapezium, this is the scaphoid. This column is a linear column that allows us to transmit force when we pinch. This is why the thumb is such an important joint, because it's actually a weight-bearing joint of the upper extremity, such as when we open buttons, pull up zippers, open jars. That's very important that we have this in good alignment. Over time, we can have wear and tear, and specifically in the cases of females, when estrogen levels decrease, there's laxity of the ligament, which allows this metacarpal to slide out of socket and edge load on the trapezium, which is shaped just like the saddle that you would ride on a horse. When it's riding on the edge, it will give uneven wear like a tire that's out of alignment on a vehicle, resulting in pain and deformity and weakness. When that happens, the only treatment to restore normal anatomy and give us better function is surgery. Today I'm going to discuss the tightrope arthroplasty. What's entailed with that, it's an outpatient procedure. It's an incision that we make over this thumb metacarpal, the trapezium, and the scaphoid. This bone here is arthritic on both the distal and proximal poles, so we can't really save it. That's removed. In order to maintain this area, we pass a small suture with a grommet here and here through the bone, which allows this to be distracted, essentially allowing this area to fill in with scar tissue. So you're floating on a bed of scar tissue when you pinch. It's not painful. Patients have found that they enjoy the function, and as well as the fact that strength will return. I follow these patients for a full year, and in the first and farther if need be, but we find that strength will improve at 3 months and then will markedly improve at 6 months. So it's a slower procedure for that, but function is fairly immediate with a short course of splinting for 2 weeks and then removable bracing for an additional 4 weeks. I'll show you a little bit about what's going into the thumb. It's quite simple. This is a piece of suture that's made of Kevlar. And on the end of this Kevlar, very small, is a small, minute grommet that goes through that suture. With a series of guides, we're able to pass this suture through the base of the thumb and into the index finger. We tension this to give the appropriate amount of tension on the finger so it's not over-tightened or under-tightened to restore the anatomy. Put another grommet, tie the knot, close it, we're finished. Other procedures require harvesting of tendons. Sometimes we can actually put an implant in, but they have not given long-term reproducible pain relief without having difficulty with the implant itself. So this one is proving to be very reproducible with minimal morbidity to the patient, which is why I've gravitated to using this procedure in my practice. Now that we've discussed the didactics of thumb arthroplasty and the use of the distraction technique utilizing the mini tightrope, I'd like to give you an illustrative case. This is an example of one of my patients that has basilar joint arthritis. There's arthritis both here at the metacarpal, the trapezium, and the scaphoid. That whole column is arthritic. As you can see, there's some very early subluxation of the metacarpal out of the joint, so it's edge loading. She had been treated multiple times with injections and bracing over this period of 4 years. She's a professional musician, so the use of her thumb is very important. She could not play her chords anymore. After she'd failed long-term conservative treatment, we went on to perform the Distraction Arthroplasty utilizing a tightrope. Here is her thumb after it's been performed. These are the two grommets that we discussed, and in the between that is this heavy ligature that we put in made of Kevlar. That suspends the thumb, and you notice now that the metacarpal is lined up perfectly with the scaphoid. There is space here, so now the thumb is not rubbing against the arthritic trapezium. This fills in with scar tissue, but allows us still the ability to abduct and adduct and pinch with the thumb. As time goes on, 3 to 6 months, this gets tighter and tighter and allows us to increase our strength. We know this because we follow them on a regular basis with hand therapy that we measure this. I hope this is illustrative and it makes you understand more about how I treat thumb arthritis.